Good morning, Internet. It is freezing in the United Kingdom today, absolutely freezing. We're having a cold spell. I've put the swags down on the side of the four-poster, and Romeo is being very close to me. My cat, in cold weather, is my best friend. And then come summer, I don't see him for dust. He's just using me. He's using me. But I don't care. We still love our cats, do we not? So we're gearing up at the moment for Mum's exploratory session in the hospital on Tuesday. So there are some issues that have been come to the attention of her and the doctor, which, well, I suppose I better not say, but there was something amiss. It's difficult talking about somebody else's health issues, isn't it? So I'm not going to go into great details for privacy reasons, but they're looking for cancer because after a certain age, that's all they look for, isn't it? Let's face it, the biggest killer probably of people over kind of 65, 75, I don't know the stats, probably 60s, it's heart attacks and cancer, isn't it? And then a bit later on, it's dementia and Alzheimer's. That's certainly what the publicity has us believe, and I'm pretty sure that's true-ish. So any little, lump, bump or test that shows something unequal or that shouldn't be happening, suddenly you're in the hospital and they're broggling around at your nethers and God knows where, looking for something. And it's such a worry. I wish, I wish there was a way that you could tell loved ones not to worry. Because, she's fit as a flea and she's, there's nothing, she hasn't lost loads of weight and she hasn't, she's not in any serious pain or anything like that. So you just think, oh no, surely she hasn't got anything. And she'll probably come out of it all on Tuesday. And I don't know when the results will happen, but, it'll probably be yet another false alarm. My mother has a lot of false alarms. And I guess that's something to do with being in your 80s. You start to have false alarms. But, of course, there's a worry, I think, as you get older about dying. And if you're not at peace with it, it can not ruin your life exactly, but it can cause you to become quite anxious. And I can feel the anxiety at the moment, and it sort of peters down, because even if you know somebody really, really well, and they're, worried or very anxious or very upset, you don't really need the obvious signals like, oh my God, I can't cope, I'm falling apart. You don't need those. All you need is, sometimes actually it's a silence. And you know by what they're not saying that they're really, really worried about it. And that's where we're sort of at. But I was thinking about, what can you do as a support or somebody to lean on, a friend, family? What can you do? And it's very difficult to take somebody's anxiety away from them. It's very, it just doesn't really work if you try too hard. And I do think there's something to be said for just sort of being there. So, we went out yesterday. Once a week, sometimes twice a week, we go out and we go to Costa and we have decafs now because we're both trying to give up caffeine. So annoying. I hate trying to give up caffeine. I'm always doing it. But it's quite important now because I've developed a sensitivity to it and it needs to stop. But I think it's harder than giving up heroin, honestly. I've been trying to give up coffee most of my life, most of my adult life, and I've never succeeded. I've never been clean, never, of caffeine. Isn't it weird? It's very odd. Anyway, we have our decaf and, we have a little chat, and they sell books for 50p in our Costa of choice. We've got our favourite one. We know the staff and, it's just something we do every week. And that idea of keeping normal and doing the same thing that you would normally do, but maybe making it a bit more, I don't know, kinder, or because quite often I get annoyed with Mum and I bitch a bit. I think we all do that sometimes, don't we? She can have opinions that grate with mine at times. Or, we love people, don't we? But we still find them annoying. I mean, thank God I don't have a husband. I mean, even the cat annoys me sometimes. And it's just as I get older, I become more and more, or less and less tolerant and a bit more crotchety. And, it's your close family members generally who get the brunt of that, isn't it? Or shop tellers. Just, I don't know. When you're upset, it's very hard to hold it in, isn't it? So if I'm worried about something, I can be quite crotchety and niggly. So I'm kind of making an effort, I suppose, is what I'm saying at the moment, just to be there and at rest, as it were, and at peace, and to try not to aggravate and not to get myself annoyed by bringing up things that might annoy us. Do you see what I mean? And my brother's very disabled, and that, yesterday, that was really upsetting her. And that's a symptom almost of her anxiety as well about the possibility of, them finding cancer and what that would all mean for all of us generally. Because I suppose I've been through it, obviously, when you have something like that, the worry period is by far the worst bit. Knowing is a relief, because even if it's bad news, you know what's going to happen. But the great unknown is just, a truly horrible place to be. I don't know if you can hear, but I'm losing my voice, and this is because I've started podcasting, because I'm talking too much. I don't know, I might have to rest it. I was going to do lots of podcasting today. I'll have to think about it. I was going to read some stories, but I've gone a bit croaky. So yes, just going and doing normal things that we normally do, but me allowing, the pleasant side of it all just to float along, rather than, talking about anything too deep. We talked about clothes, and I think that's a really good place to be. She bought a Jacques Vert 60s jacket the other day. She was really pleased about it. So we just talked a lot about that, and we talked about clothes that she'd like to buy. She's very, very fashion conscious, my mother. She likes to glam up when we go out, She loves all that. A woman who was, in her prime, if you like, what she considers her prime, because my prime is in my 60s. My mum's prime was in the 60s. Do you see what I mean? So she still has that self-discipline, I suppose, where women would get up and put on their makeup and, wear good clothes and be well presented at all times, and always have the laundry done and all those things. She's a very tidy person. Unlike me, I'm a complete and utter, wreck indoors. Everything. I did tidy up actually the other day, and I tidied up all my shelves. I felt very good about it. And they all look really nice now, but I don't know how long they'll last. Because when I'm looking for something, books just get strewn around. I'm looking for a quote or something. I'm looking for, some inspiration. And then they all get shoved back on the shelf in the wrong order, or, I like order by size. If we measured our personality by the way we stack shelves, I think it'd be quite revealing. Some people do them alphabetically. Other people do them, my brother, for example, he's a book dealer. He does them in sections of subject matter, which would be obvious because he's a tradesperson, a dealer, I should say, antique books. And I do them completely and utterly by size. A little bit by context, but it's more about size. For me, on my bookshelves, size matters, definitely. Anyway, I digress. So yes, getting back to this, how do you, what do you do for somebody who's going through something, it's making them anxious, and it may very well be bad news, or it may be good news, you just don't know. So I think, what seems to have worked for me is to support mum by just being there, having a little chat, maybe a few more chats than I normally would. Quite often I ignore her calls because I'm busy. I'm recording or practicing, and I don't answer calls while I'm practicing my instruments. It just doesn't happen. So, but I am making more of an effort to check to see if she's rung, and then maybe message, are you all right? And that little bit of support, it's not necessarily the support per se, as in a sort of emotional support, although that's a big part of it, but it's the taking the mind off the worry. So creating something that's a diversion. And I think that's really, really effective, because if you just give somebody's anxiety a rest for, half an hour, it's a relief for them, because, they're able to let it go for a while, and therefore, the rest of the day might seem a little bit more tolerable. So, yes, she's got to go in. I'm going with her. We're getting a lift in from a friend who, because of the parking at hospitals in this country is just so expensive and difficult and complex. So we're being dropped off. I'm going to be around, but these investigations involve, I think, filling her up with air and dye or something. And then she goes into there's a probe, which doesn't sound very pleasant. And then she goes into some sort of camera, and that's how they're going to look at her stomach and some other nethers. So it's a pretty horrible... I guess when you get older, you just don't want any broggling around. I mean, it's just horrific. As young women, you got used, didn't you, to, your cervical smear, which you had to do every year or every 3 years or whatever it was. You had babies, maybe, so there was a lot of, open crutch stuff, and you just got used to it. And by the end of it, you're quite blasé about it. You just, it's just another doctor prodding around. And it kind of... your brain kind of acclimatizes to it. And I think also when you've got, especially if you've had a baby, you're just thinking about the baby. You don't really care about what's going on with your body. You kind of almost disassociate it from it for a bit. But I think, I've noticed as I've got older that I really wouldn't like to have to go through all that. And when I had my cancer, I did have to go through all that. Much, much worse. They had to get an exploratory device up the back end and all the way round my colon to my appendix, which is where my cancer was. And they were pushing and shoving my body around this table to try and get this camera. They give you a sedative, which is it's just weird. It sort of makes the process even weirder. But what I did do on mine, and I think this is really important as well, and I think it's really important for women to have agency over their bodies, especially if you've, been a victim of abuse. I walked in and I just had major surgery, so I'd had quite a lot removed because of the cancer. And I guess it was maybe 6 weeks after. No, it was probably about 3 months, but it was quite soon after the operation anyway. I was healed, so it was maybe 3 months. And there was a man there. He was quite a good-looking man, tall, good-looking man. And he was introduced to me and by a nurse, the head nurse. And she said, this is Mr. Whatever, and he's training, and he's going to be doing your colonoscopy today. And I just thought, well, I don't want a student, and a good-looking student as well. That did have an impact on me. I'm not going to lie. I would have preferred it to be somebody, unattractive, or a woman. In an ideal situation, you want a woman. I don't know why, but that's my right. Anyway, I'm running short of time, but I said no. I because they ask you if it's okay because they're training, and I just said no. It's not okay. I've just come out of major surgery. I don't want anything to go wrong. This is really important to me. So the head nurse did it, and I felt much better about that. But, they don't make it easy for you to have agency over your body when you're going through all these things. So I haven't quite finished what I was going to say about that with Mum, but I'll be covering that anyway, and I'll tell you, I'll tell you guys all about what happens. I'm not going to be in there